It's time for a Wellness Revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctorate.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. This is Stacy Banfield here with Dr. Stephen Hotze, founder of the Hotze Health and Wellness Center. And as always, you can download our podcasts at hotzepodcast.com. That's HOTZE podcast.com. We've talked before on other podcasts about the dangers of statin drugs, and now we're going to tackle on this podcast heart disease, how you can prevent it, or even if you already have it, what you can do to reverse heart disease. So very excited about this program, Dr. Hotze, and what you have to say on this subject.
Well, thank you so much, Stacy, and thank each one of you for joining us. I do believe that you need a doctor and a staff of professionals to coach you on a path of health and wellness naturally without using pharmaceutical drugs, so that as you mature, you've got energy, you're brimming with vim and vigor, you got enthusiasm for life, and you got to get up and go. Wouldn't you like to feel that way every day? Well, you should, and there's no reason. I don't care if you're 30, 40, 50, 60, 70, 80, 90. You ought to be brimming with energy, and you can be. Now, I'm going to visit with you today about the causes of heart disease. Just had a podcast. We discussed cholesterol and how important cholesterol is as an essential molecule produced by the body, every cell in the body, predominantly by the liver, that provides some tremendous value to our bodies. The cholesterol provides a membrane around every one of our trillions of cells, 50, 60, 70 trillion cells, how many ever we have. I've seen different readings on that. It provides the membrane. It's the building block for the adrenal hormones, for the sex hormones. It provides the 25% of the weight of the brain is cholesterol. It enables the neurotransmitters to function properly in the brain. That means you can think well when you've got cholesterol. It is also important for the production of bile in the gallbladder, which helps you digest your food. And it's important for the production of vitamin D. It's a building block for vitamin D, which is really a hormone made from cholesterol. So cholesterol is an important molecule made by the body. And so what's the cause of heart? If it's important, how could it be causing us to have heart disease too? You know, the drug companies have made it out, and most conventional doctors believe the drug companies' marketing that it's bad. It's the bogeyman. Well, once they came up with the idea that cholesterol and fats were causing heart disease, because they look on the arteries and they find these fat plaques. The fat plaques have cholesterol in them. Oh, therefore, cholesterol must be causing the problem. In fact, that's not the case. The cause of coronary artery disease and arterial sclerosis anywhere in the body is inflammation of the arterial lining, the endothelium, the adventitia, the muscles that surround the inner lining of the arteries. They get stretched, they get inflamed. They're inflamed from what? Well, from the petrochemicals in the environment, things you breathe, eat, drink, slather on your body. You put all these petrochemicals in your system, and guess what? They're toxic, and they adversely affect your cells, and they cause them to become inflamed. Heavy metals can do the same thing. Lead, mercury in your amalgams. I had mine taken out 20-something years ago. Get rid of the mercury. Cadmium, aluminum, you cook on aluminum pans, you get these heavy metals, and they cause inflammation in the arteries.
Dr. Hotze, that's such a great point, because a lot of people think, well, I'm eating pretty healthy. You know, there's some things that I'm doing to reduce inflammation, but really it's so widespread. I mean, the ways you can get inflammation are varied.
You know, the toxins that cause inflammation. So, and then another thing, anytime you get an infection, you get inflammation, the bacterial products. If you've got bad teeth, rotting teeth, bad gum disease, that has a lot of bad bacteria in it that produces toxins that inflame the arteries and the coronary arteries and other arteries. And then sugar. Sugar produces inflammatory products, glycinated end products that cause inflammation in the arteries. Sugar is very, very bad. And a person that, and where do you get sugar? Well, of course, you get it out of a bowl, sugar bowl, or out of a packet, right? No. Any carbohydrate, simple carbohydrate, is converted to sugar. White rice, potato, those are just all starches, which are sugar molecules hooked together. As soon as you put them in your mouth, they break apart and you got elevated sugar. Same thing with bread, pizza, pasta, cake, rolls, whatever, all those bread products, grain products, all are starches, which are simple carbs and which are sugar molecules hooked together. And once you put them in your mouth and they start to digest right away, they break down into sugar. So your sugar levels go up, and that causes inflammation in the arteries. So you've got 4 causes of inflammation. So the inflammation, once you get the inflammation, the arteries become raw. You understand that? They're like scraped on the inside, like if you took sandpaper and rubbed it across your back of your hand, it would be raw and weepy. Well, that's what the inside of these arteries look like. Now, normally, the body would heal the arteries, and it would use collagen, which is a protein that is really the glue that holds all our cells together. I can pick up my skin, and it goes right back down, and that's because the cells are all hooked together by collagen. Collagen is what holds all the cells together. It lines the inner lining of the arteries and the adventitia, right between the inner and outer walls of the artery. You've got cholesterol that would normally be laid down. Now, to have cholesterol, you've got to have vitamin C, and human beings don't make vitamin C. All the mammals in God's creation, with the exception of humans, monkeys, and guinea pigs, and some bats in South America, don't make vitamin C. All the other vertebrates, any animal with a backbone makes vitamin C, and they make approximately 1,000 milligrams per 25 pounds of body weight. And mammals and other animals don't get heart disease. Why? Even with high cholesterol, they don't get heart disease. Why? Because they have vitamin C that enables them to make collagen that heals the inner lining of the arteries. Now, let me show you my hand. Think of my hand as the heart, and think of this vein going down as the left anterior descending artery. Now, imagine it's inflamed, and the heart's beating, 12 times a minute. It's beating 60 to 70 times. It's beating 60 to 70 times a minute, and it's beating 100,000 times a day. And every time it beats, it stretches that artery out and compresses it. And if it's inflamed, what's going to happen? Well, it's going to begin to deteriorate, and the body doesn't like that. And if it can't make enough collagen because you don't have enough vitamin C in your system, you're not taking enough, it has a backup mechanism. It begins to take lipoprotein, a protein molecule that has cholesterol attached, and begins to bandage the surface of that artery to provide stability. And then that plaque begins to absorb calcium in the blood and becomes calcified. You get atherosclerosis, hardening of the arteries. As a matter of fact, atherosclerosis means hardening of the porridge. It's like porridge is what the cholesterol is. And that's a normal mechanism to give rigidity to these vessels that are deteriorating. The body has to have a backup mechanism. Unfortunately, though, if you continue to have inflammation, the arteries are going to narrow more and more. You're going to get more plaques, and then you're going to have platelets run through, or blood's going to run through there. And if it's viscous, that means if it's heavy, it can form a clot. And when it forms a clot on one of these plaques and breaks off, then it can clog up the end of the artery, and the next thing you know, you have a heart attack. That's not good. Damages the heart muscle. So we want to prevent that. We want to arrest it if you have the problem and prevent it. Now, the only way that you can find out if you have any calcium on your artery is to do a CT heart scan. We do that here at the Hotze Health and Wellness Center. I think that's a very important test to see what your score is if you have any calcium. If you have calcium, what's the score? Is it 510? Is it 500? Is it 3,000? I've seen them from 0 all the way up into the 4,000s, and that's significant. And if you have it above 400, you dramatically increase your risk of having a heart attack.
And you recommend people start that at the age of 40, actually, isn't it? Or 45?
Well, men 40, women 45 to 50, because men tend to get the problems earlier, about 10 years earlier. Women are protected with their hormones until menopause. So they get heart disease at the same rate as men, but usually at a 5 or 10 year later interval, just the way the hormone system is set up. That appears to influence the occurrence of heart disease.
Other way, it's silent, which is why you have to get the heart scanned.
Right. And most heart attacks occur in individuals without any warning. Bam, they got it. first heart attack, and half the people that have a first heart attack die. So it's a silent killer. It just all of a sudden comes up and whacks you. So it's important for you as an individual to get a heart scan done to see what if any, how much, if any, calcium you have in your arteries. And if you got it, that's going to make you aware that you can do something about it. Now, we've had patients, guests of ours that have come in and we put them on a good program. Now, I don't put them on any statin drugs. I don't believe the statin drugs work. I believe they cause a whole lot more health problems. They're much more dangerous to you than they are helpful by a long shot. In fact, overall, all-cause mortality is increased in most studies when they study statin drugs. Not just heart disease, but all-cause mortality increases when you take statin drugs. So you don't want to increase your mortality rate. That doesn't make sense. I'm going to spend, $1,000 a year, $1,500 a year to make sure I can die quicker than I normally would if I didn't do anything. It doesn't make sense.
No, it does not.
So anyway, what you do, here's the key ingredient to help prevent, to arrest, and reverse coronary artery disease, which is atherosclerosis. First, you want to take coenzyme Q10. Coenzyme Q10 enables the cells of the heart to generate energy in the power plants. It's so critical and so important. And coenzyme Q10, by the way, is poisoned by the statin drugs like Lipitor and Simvastatin and all these other statin drugs poison the production of coenzyme Q10, which you need for energy production in all your cells, particularly the heart, because the heart has got more mitochondria, more power plants per cell than any other organ in the body. Brain second, liver third, and you want to have good energy production in your heart, in your brain, and in your liver. That's so critical. Second thing, and frankly, it's even more important than coenzyme Q10 is vitamin C. And I would take 1,000 milligrams per 25 pounds of body weight minimum. And what that does is enable your body to make collagen. Great studies were done by Linus Pauling and Matthias Rath. Dr. Rath and Dr. Pauling have written extensively and done studies showing in animal models that it's low-grade scurvy. It's the lack of vitamin C that causes the inflammation of the interior arteries, and you need a lot of vitamin C in the areas of the arteries when they deteriorate to make collagen so you can lay that down and keep your arteries clean. Matthias Rath wrote a great book, Why Animals Don't Have Heart
Attacks, but people do.
Yeah, but people do. Read that book. That's great. So I'm a strong advocate of that philosophy that vitamin C is a key ingredient and essential to help you prevent heart disease. I've taken 10,000 milligrams a day for the last 25 years. Now I'm up to 15 to 20,000 milligrams a day of vitamin C. And
you can work up to it.
Yeah.
I mean, a lot of people have to work up to that amount.
Right, or you can take it to stool intolerance. I've done my heart scan twice. So did it about, 10 years ago. It was fine. Did it a year ago. It was clean as a whistle. There's no calcium at all in the arteries, which says a lot. I've got a brother, a younger brother, who's got significant calcified arteries. He didn't take his vitamin C. I did. I believed in what Dr. Linus Pauling and Dr. Rath taught. So anyway, vitamin C, coenzyme Q10, L-carnitine helps your body convert fat into energy within the cells. Magnesium is so critical and important. That helps relax the smooth muscles, lowers your blood pressure, regulates your heart rhythm. Also, it helps prevent insulin resistance at the cellular level. It helps the body better convert sugar so it can get into the cell and be burned rather than converted to fat.
We also have a really good podcast on that. Carolyn Dean. Yeah. She wrote that Magnesium Miracle.
Is really critical to that. D-ribose powder is important because it's the building block for the energy molecule ATP. It's the foundation. Ribose, the D-ribose molecule is the foundation of the ATP. So I would take that. It's also important to take omega-3 fatty acids, and that's important for brain function. EPA and DHA are two extremely important omega-3 fatty acids that the brain uses to help the brain function. So it goes to the brain, and that's really good, particularly for developing brains in children. I highly recommend that mothers give their children a teaspoon of cod liver oil every day. You'll get the EPA and the DHA, and it'll be fine. So these are some things that you can do to prevent developing coronary artery disease. What are they? Cut the toxins out. Detoxify yourself, and the vitamins, minerals, and nutrients help you do that. Cut out, make sure you get rid of the mercury fillings in your mouth, and don't be cooking on aluminum, and don't be drinking anything out of lead pipes. I don't think they're allowed anymore, but there may be some. You don't want that. Third thing you want to make sure you do, keep your teeth healthy. Healthy teeth, healthy heart. You got bad teeth, bad gums, you're going to have a bad heart. I'll assure you that. Also, you want to keep your stomach healthy. You want to make sure you don't develop any ulcers in your stomach, which are caused by Helicobacter pylori, and that will also cause inflammation in the heart. So you want to make sure you stay healthy. You want to cut dramatically your sugar intake and intake of simple carbohydrates, because those cause inflammation in the coronary artery as well. Those are some key things that you can do. Stay away from those toxins, and then make sure you give yourself vitamin C, coenzyme Q10, magnesium, L-carnitine, D-ribose, omega-3s, among others, are very important for good heart health and for cleaning up your arteries. By the way, also important in that is vitamin K2. Helps pull the calcium out of the arteries, as does L-lysine and L-proline are very important amino acids in the production of collagen, and also helping pull the calcium out of the arteries. So that's what you want to do. You want to arrest and reverse and then prevent any development of coronary artery disease by stopping inflammation in the coronary arteries.
All great information, and the good news is these are things that you can start on today. And just as a reminder, a vitamin is not a vitamin. So what we do is we vouch, where we stand behind the vitamins that we produce here at Hotze Vitamins. All you have to do is call 1-800-579-6545. That's 800-579-6545, or go online, HotzeVitamins.com. That's HotzeVitamins.com. And you can speak to one of our certified nutritionists. They'll be more than happy to help you and get you on that path of health and wellness. Well, Dr. Hotze, thank you for sharing all that great information with us. And thank you out there for joining us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice, and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.